Good afternoon to all. I am Professor Manavalam. Now we are going to see about the case study presentation on vitamin A deficiency in detail. Now I am going to read the case scenario in detail. So everyone, you have to carefully listen the case scenario. After listening this, I will ask question. So you have to give answer for these questions. So it is not a unknown fact to you people or unknown condition to you people. Every day you are overcoming this condition in your ward sector. So now I am going to read the case scenario. A 3-year-old girl child with the weight of 7 kg and height of 75 cm is brought with the complaints of dry eye, difficult to see in dim light and difficulty in vision. At the same time, pain in the left eye with discharge. On investigation, they found out that the spots that is present in the eyeball. This is about the case scenario. Are you clear about the case scenario? If you are clear about the case scenario means I will give a second for you people to think and give answer whatever questions I am asking to you people. Now I am going to ask a question. So what is the diagnosis? By listening this case scenario, what you understood? Tell, if you know means tell me the answer. What is the diagnosis?
Vitamin A deficiency.
Very good. So this is a vitamin A deficiency. Next question is, so someone who give the WHO staging of vitamin A deficiency.
Primary signs: X1A conjunctival xerosis, X1B bitot spots, X2 corneal xerosis, X3A corneal ulceration, X3B keratomalacia.
So this is about the WHO staging. So there are primary signs are there as well as secondary signs are there. So based upon this only we will diagnose the condition. Next we move on to the next question. What is the prognosis of vitamin A deficiency?
It's irreversible.
Yes, it is irreversible, and also at last there is a chance of scar formation that will be present in this case. Next move on to the next question. How we can prevent the condition? I didn't ask you to what are the sources, how to prevent the vitamin A deficiency. Now you will give the answer.
Administer 1 dose of 1 lakh units of vitamin A at 9 months, followed by 4 more doses of 2 lakh units each at 18, 24, 30 and 36 months.
Yes, that's all. This is the way we have to prevent. This is the vitamin A prophylaxis. We have to advise the baby to have. Through that we can prevent the vitamin A deficiency. Next we will see about the what are the vitamin A rich resources.
Animal foods: liver, meats, fish, cheese and milk. For plant resources: leafy vegetables like spinach, broccoli and peas.
Yes, that's all. So these are all the vitamin A rich resources. So everyone known very well about the vitamin A resources. Everyone, they are including the vitamin A resources in the diet, but they are unaware of that which type of foods, animal as well as vegetables, they are having the vitamin A. So we have to, as a nurse, we have to educate the patient what are the vitamin A rich resources. So vitamin A deficiency means nothing but it is a inadequate dietary intake of vitamin A that results to satiety, inadequate physical need. So the body is not able to meet the vitamin A physiological needs. So as a person we have to have adequate amount of vitamin A in our diet. How they will diagnose the vitamin A deficiency means by doing the physical examination they can find out the vitamin A deficiency, and also at the same times by collecting the history. Take as example of we will know about the night blindness, presence of acne, difficulty in vision, dry eye, pain. So these are all the certain aspects we can find out by collecting the history from the child. Next, laboratory investigation. So laboratory investigation in this vitamin A deficiency, they will check about the serum retinol level. If the serum retinol level it is going less than 20 milligram per deciliter means it indicates that vitamin A deficiency. And apart from that, eye examination also necessary. Thank you all for your participation. Thank you.